Dyslexia is a mental illness in which the brain mixes up the letters of words. Due to this, it makes it difficult for the person with this disorder to be able to associate the sounds of the letters with the words. Oftentimes, people with dyslexia have troubles reading and writing and spelling, and this normally follows them throughout their life. Dyslexia can also be known as specific reading disorder or just a general reading disorder, depending on the severity of it. Symptoms of dyslexia vary between the ages of the people with the disorder. Children's symptoms will often begin with they will start talking later in life. Their vocabulary won't build up as quickly as a child of their age should. Adults with dyslexia will continue throughout their life to have troubles with reading and writing and spelling. Another aspect of adult symptoms is that they will have trouble planning and organizing certain things. Dyslexia is known to be a genetic disorder. This disorder it causes structural differences in the left hemisphere of the brain. Experts are unsure why that there is such a difference, but they know that this is part of the reason why it is caused. Also, experts have also found cells that they believe to be responsible for this specific disorder. Dyslexia can be linked to many other emotional disorders. One example would be attention deficit hyperactivity disorder. Children with dyslexia often have an increased risk of having an anxiety disorder or depression with the dyslexia. Treatment for this disorder varies between different people. Everybody's different, even though if they all have dyslexia, the treatment will pertain to that specific person. And most of the treatment that is offered does not involve medication. The treatment that is the most successful is tutoring. Now, it is said, and I read, that the sooner the disorder is located and as soon as it's diagnosed, it's important to start tutoring this person or child, because the sooner the treatment starts, the sooner and the better the outcome will be for that specific person. A lot of the times the tutoring does not involve reading itself, reading or writing. Many dyslexic people rely on vision and touch to learn instead of reading or writing like the rest of us. And because of this, it's just difficult for them to learn, and these are different ways for them to be able to learn. This learning and this tutoring is better if it continues throughout life. There are many dyslexic people who have achieved great things even though they can still have trouble throughout their life with this. Nursing interventions or things nurses could do for dyslexic people is just try to understand the disorder and how they can't help it. Many people think that dyslexic people have hearing issues or sight issues, But no, it's psychological, it's in the brain, it's structural, and nurses just need to look out for that and try to be able to identify it in people. And I would say the best thing for a nurse to do would be to, read their care plan, to read it with them, try to get them to understand it, because if you just give them a piece of paper to read, they're not going to understand it, and it'd just be a lot easier if the nurse would take the time to read and actually explain things to the patient. Now, dyslexia is not impossible to live with as long as tutoring occurs, and even if it doesn't, dyslexia isn't a permanent, it's not going to leave somebody behind, or it's not going to make it too difficult for the person where it's hard to live a normal life. Dyslexia can be managed, and the people with dyslexia can be very successful even with their illness.